A cesarean section is one of the most common surgeries performed worldwide. It is frequently characterized by the public as a routine, surface-level bikini cut. Anatomically, the human abdomen is a fortified enclosure. It is a structure evolved to repel intrusion and protect internal organs from the outside world. To safely deliver a baby, a surgical team must systematically navigate 7 distinct biological barriers. Before the incision, a spinal block numbs the lower body, allowing the mother to remain awake to meet her child. Successful delivery depends on the team's ability to navigate through these protective tissues in a sequence of precise manual steps. The surgery begins with a horizontal incision low on the abdomen. This part's the first layer, the skin. Directly beneath the skin is the subcutaneous fat. The surgeon moves through this yellow layer to reach the structural defenses of the abdominal wall. Zooming in, we find the third layer, the fascia. This is a tough, white, fibrous casing that provides the abdomen with its primary structural integrity. Bypassing it requires a deliberate, focused cut. At the fourth layer, the strategy changes. When the team reaches the abdominal muscles, they do not cut. Instead, they physically separate the vertical muscle bands, pulling them horizontally apart. By stretching the muscles rather than slicing through them, the team creates a clear window into the cavity while preserving the mother's core strength for her recovery. This approach bypasses the body's armor while leaving its foundational architecture intact. After moving the muscles aside, the surgeon encounters the peritoneum. This fifth layer is a thin, transparent membrane that serves as a protective sac for the internal organs. Opening that membrane reveals the sixth layer, the uterus. After 9 months of pregnancy, this muscular wall is thick, dense, and heavily supplied with blood. The surgeon makes a precise horizontal incision in the lower segment of the uterus, a technique used to minimize blood loss from this powerful muscle. This exposes the 7th and final barrier, the amniotic sac. The team punctures this fluid-filled membrane, and the fluid is drained from the surgical field. The baby is then gently guided out of the incision, and the umbilical cord is immediately clamped and cut. This delivery is the result of a coordinated effort to navigate the body's highly evolved protective systems. Once the baby is with the pediatric team, the second half of the surgery begins. The focus shifts from extraction to the reconstruction of the abdominal wall. First, the surgeon must manually detach and remove the placenta, leaving the uterine cavity empty. Closing the tunnel from the inside out, the deepest uterine muscle is stitched with dissolvable thread. Moving upward, the tough fascia is sealed to restore structural integrity. Finally, the fat and skin are closed, returning the body to a solid, unbroken state. The entire procedure is a 2-part operation, a systematic entry followed by a meticulous anatomical rebuild. The C-section demonstrates the precision of modern surgical techniques and the physical resilience required of a mother's body.